The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. This is the October 19th, 2020 Westminster City Council study session. We have a couple of items on the agenda. We have some presentations regarding to our COVID response, one discussion item on the Rocky Mountain Metropolitan Airport, and then we have an executive session. So I'll start with council reports. If there are any members of the council have any items they want to report at this time, please put your names in the chat and then I will call on you. Mr. DeMott, Councilor DeMott, if you would, please.
Yeah, thank you, Mayor. I just wanted to share that I attended the Inclusivity Board this last week. This was their first meeting since following up after their retreat. The board talked a lot about some of the things that they decided in their retreat, some different initiatives. One of the big initiatives that they had talked about was having a member of their board come to council and as well as go visit other boards and commissions. So definitely encouraged that. And they also asked about, whenever there was times that, they might be able to weigh in on different topics that we're talking about. So kind of the general consensus was if they had somebody visiting us that they could work either through me or through the staff liaison to be able to, basically get on our radar that they want to talk about something. The other thing that I recommended is if they have specific things they want to bring to us to work through the staff liaison to also get on our agenda for a study session if there was something specific they wanted to share with us or get feedback on. So there was a lot of other things that they're working on. I know that they're working on some ideas they have around policing. I know that they had a draft they gave to their group, and they're going to go back and forth with that and then present that to to staff. So it was a good meeting, but that was what I wanted to share with you. Thanks.
All right, Counselor Smith.
Thank you, Mr. Mayor. Last Wednesday, I had an opportunity to engage with residents at our market drive-through night. And it is every Wednesday from 4 to 6 from starting in October, running through December. So, and that is in conjunction with the senior hub. And to be quite honest, we ran out of food quite quickly. And it's boxes of fresh fruits and veggies, dairy products, and then had the opportunity to give out local gift cards for a restaurant in Westminster. So if you're hurting or need any assistance with some fresh veggies or produce, please stop by Wednesday night coming up from 4 to 6 p.m. So that's all I have. Thank you.
Other members of council have any updates they want to provide? All right, seeing none. Mr. Tripp, you have a city manager's report.
Thank you, Mr. Mayor. I don't have a report this evening other than the items on the agenda. Thank you.
All right. Moving on to the next item. Mr. Tripp, Mr. Dorr, or whoever's going to lead this piece. This is a COVID response.
Thank you, Mr. Mayor, Mayor Pro Tem, members of City Council. We have 3 items tonight. Initially here, we're going to hear from Max Kirschbaum as an update that we do weekly on COVID and the impacts of the virus and the status of the virus. And that'll be followed by some comments and opportunity for you to ask Dr. John Douglas from Tri-County Health questions. We thought we'd start with Max this evening to give you an update on data. Following that, then we'll have a answer questions that Councilor DeMott may have concerning an issue that he raised via email with the staff here this last week on homeless encampments. So, Max, if you would join me here and take it away with the data update.
Thank you, Mr. Tripp. Good evening, Mayor and Council. Probably good that this is an intro to Dr. Douglas. I'll be happy to show the case data, and I'm sure he'll be happy to answer the hard questions. Okay, Matt, if you could go to the next slide, please. I intend to just show the single slide again tonight. You saw this slide for the first time last week. Based on your feedback, we've added a column, the Westminster column, which attempts where we can to provide information on, in this case, the new cases per 100,000 population. I'll point out that all of this data is as of last Friday. The reason we did that is so we can begin to get consistency of data on the same day. So we're picking the Friday because there's usually also variability on reporting over the weekend. So we're using Friday data. And I will also sprinkle in verbally a couple of updates with today's data where I can. So first, looking at the top row, which is the new cases per 100,000, you'll see that over the change over the last 7 days, all the arrows are going up. And Adams County, as of Friday, was at 346. And Jefferson was at 169. If we break down the Westminster data as best we can on the Adams side of the county and the Jefferson County side of the county, you can see we're at 315 and 149 cases per 100,000 over the last 2-week period. Now, I'll verbally add, after 4 o'clock today, I checked today's data for the state and both counties. The state has, just from Friday to today, has gone from 187 to 203. Adams County has gone from 346 to 379. And Jefferson County has gone from 169 to 189. So in all 3 cases, the data is even climbing just since Friday. Looking at the second row, the percent positives, although it's a different format, we've been showing you this data for a few months now, so you're familiar with the percent positive rate and the metric trying to be under 5%. No, with today's information, neither county or the state would be under 5%. Looking at the hospital admissions row, this is can be a little bit confusing. I know there was some questions on it. So I'm gonna read a definition because I think it will help maybe better understand what those numbers are. And I'm taking this right off the CDPHE website with the dial metric. It says that stable, not greater than 25% increase or declining counts of new confirmed COVID-19 hospitalizations in the county's referral hospitals in the last 14 days compared to the previous 14-day period, or no more than 2 new hospital admissions of county residents with confirmed COVID-19 on a single day in the last 14 days. So I know that one's a little bit harder to get a grip on, but if you just look at the color-coded portion of that for both counties, it would be in the less than stable, the not stable range, with admissions greater than 2 on a single day within the last 14-day period. So that's the update for today. Again, using the 3 primary metrics that the public health officers are using in making their determination of dial position for the individual counties. With that, I'll stop there and either take your questions, or it might be better to hear Dr. Douglas, and then we can direct the questions either to me with this information or to Dr. Douglas, who would be a far greater authority than I am. That's all.
Counselor, would you like to defer till after Dr. Douglas? You want to ask now?
I think I could ask mine now and you should be able to answer it. If not, you can defer letting Dr. Douglas answer it if you want. What I'm curious about is, throughout the year, the concern was that we would see a spike in the fall. So, potentially that's maybe what we're seeing, but what I'm really curious about is data comparing right now compared to, say, March and April. Like, are the case rates under what we were seeing at the beginning of this, comparable to what we were seeing at the beginning of this, in line with what we were seeing at the beginning of this?
I think if you look at the entire graphed period going all the way back to, say, the beginning of April, the raw numbers were higher then than they are now, but the rates per 100,000, that might not be, I don't know for certain, but I would get, because we weren't calculating it back then as per 100,000, I would guess that these per 100,000 may be at or above that level at this point. That's as close as I can come to a good answer. I can do a little more looking into that, or maybe Dr. Douglas would know better.
I'd be curious to see how it matches up, but I would also be curious, as Dr. Douglas shares, the thought of, is that what we're seeing is a false spike? Maybe we don't know, but maybe we have some idea whether or not we think that. But thank you.
Other questions for Mr. Kirschbaum before we move on to Dr. Douglas? John, you got your mic open?
I think I do. Can you guys hear me?
Yeah, we can hear you. Do you want to go ahead and start with us, please?
Sure. Well, let me say a few things. First of all, Max, that was a great presentation. I need you to start having them for me. I really like the way you put all that together. The only thing I would add is that Max is right. The rates numbers of cases, and therefore because the population has really not changed substantially, we did have a correction in July. The state's now using, I believe it's state calendar or FY19 data as a denominator, but it both absolute number of cases as well as the rate of cases is higher now, Councilmember DeMott, than it was back in the springtime. Everybody in their right mind knows that or believes that's due to just simply more testing. When the school public health modeling team tries to guesstimate, and it's always sort of a guesstimate, as to how much true infection was happening then based on what we were diagnosing and correcting for a number of factors. We think we were diagnosing at best maybe 20% of the cases back in the spring. We think we're probably upwards of maybe 35, 40, 50%. In August, we think we are actually in one period up to around 80, 85% or so. So we know there are cases we're missing. We know we're diagnosing more cases. If you simply look at case numbers or frankly incidence rates, it is higher this fall, but we think that's just due to greater ascertainment. So Max did a very thorough job of pointing to the direction of the data for the state, for Adams County and Jefferson County, and his data suggests that Adams is increasing faster than Jefferson. Adams is increasing faster than any county in the metro area, and it's now got, if not the highest, one of the highest case rates in the state. And he's correct that the past 2-week data is right around the 350 level, but it looks like we're edging above 350 as a 2-week rolling incidence rate. And that's important because 350 is the threshold you get into or takes you into stay at home territory. So while Adams County is technically at level 2, level 2 goes up to 175. The county's been above 175 for some time. And that was the reason why last week the state came to the county and said, you've put together a really fantastic mitigation plan. However, most of this is dependent on stuff that will not happen very quickly. Really excellent communication. The county was putting together a good plan to provide financial assistance for people, low-income people forced to miss work due to quarantine and isolation. They're putting together an app so citizens can understand where hotspots are. Although honestly, if you live in one of those hotspots, you're kind of stuck. What are you going to do about it anyway? So there are, I think, some really good things they put together. They put together a fantastic video that I had the chance to see a draft of last night. So I really applaud them for doing really good work. But unfortunately, these things are not assured or maybe even not likely to turn off transmission quickly. And the state has sort of given the county till the end of the week before Halloween to figure out, are we going to be able to make the cut or not? If we're not, then the plan from the state at that point would be to help the county figure out what it means to transition into level 3. Now, what I don't know, because the fact that the county's rates have gone up so fast, and again, we may even be at stay at home, which is obviously a more restricted economic category. I don't know whether the state is going to require or rather accelerate that time frame. They haven't really said, whoops, it looks like you're going to need to go from level 2 to stay at home. But it's not impossible, depending on how rapidly the rates rise and how hospital rates around the state go up, that sort of thing could happen. That's just me speculating. That's a random speculation, but I'm just sort of trying to plan for the worst or think about what the worst could be while I'm struggling as hard as I can to make things as good as possible. I will say that what we discussed with the county last week around trying to hasten the reduction in transmission involved the issuing of public health orders. To me, as a public health director, nobody likes it when we issue public health orders. And to me, it was a really good process. The county worked with us closely to sort of generate some ideas. And as you're probably aware, there were 3 different categories of ideas. One was to reduce closing time, last call, from 11 to 10. 10 o'clock is actually closing time in level 3. So it was just a preemptive reduction in hours that alcohol could be sold. The rationale for that was that age groups most heavily involved with the highest rates in Adams County's transmission increases were people in their 20s and 30s. And the observation that in other places that those are groups that are most likely to enjoy socializing in public settings where alcohol is served, and that reducing that can be associated with reduction in transmission. The second one was to reduce the size of social gatherings. And the idea here was that Tri-County's data is telling us very loudly that when we ask people that we interview who've been recently diagnosed, where were you? What sort of public settings were you in? Or what sort of settings around other people really were you in during the time that your infection was likely acquired? We kind of helped them back calculate. And far and away, the most common answer we got was small, less than 10, or large, greater than 10 private gatherings. And that sort of observation out of the data was highly consistent with the anecdotes that we've been hearing, you've probably been hearing, everybody I know has been hearing, which is frankly, people are kind of tired. They're kind of weary with the COVID precautions. They want to be with their friends. I think maybe part of the equation might be that during the summer, we were talking about getting schools open. We were talking about the Broncos playing. We were talking about restaurant capacity. And what I'm hearing is at least part of the message that came through was that's where all the careful attention is. It's fine what you do in your own home or your friend's home. And we weren't really messaging, yeah, hold on. There is a restriction in those areas, or sorry, in those categories. And frankly, I think folks just weren't paying attention to that. So it's safer at home level too. Personal gathering size is actually only 10 people, but it's likely that many folks were not aware of it or really not having it drummed into their head that this was an important thing to do. So between fatigue and, again, probably the lack of awareness, I think that does look like a major issue. And so we issued the order that the restriction in public gatherings indoors be 10. By the way, that's the same number as we already had for level 2. So arguably that wasn't really a big difference. It was mostly clarifying the existing reality, but it did reduce the level of indoor activities to 5. The premise being that we have good reason to believe that being outdoors with good ventilation is safer. So let's incentivize people to think about that. I mean, it's getting colder, and to be outside, of course, you have to dress more warmly, but if we can figure out ways of incentivizing that, that would be a good thing. And then finally, it was reducing spectators at sporting events. This was mostly based on anecdotal observations by many people we had talked to around Adams County that, gosh, I saw a lot of people in the park, or a lot of people at that soccer game, a lot of people at that football game. And we do know that among the things Boulder did when they had their big outbreak, which they quickly contained, was that they reduced spectators at sporting events. So honestly, what we worked on the county with was sort of picking and choosing plausible, but by no means proven ideas about how we might be able to reduce transmission in the county. I will note that over the weekend, at least Ray Gonzalez, the county manager, got endless phone calls about people saying, oh, here's a group not doing what they're supposed to do, or here's a street party and this kind of thing. And we had a long call today. It is pretty clear that we don't have good immediate enforcement for gathering situations. We don't really have staff to send out at 10 o'clock at night to somebody's block party or somebody's backyard barbecue running over. And so we're brainstorming. We've got a call with a number of folks tomorrow. We're going to actually see if we can invite some law enforcement colleagues to join us. Mayor, you and I talked a long time ago about the likely inability of law enforcement to help us enforce masking orders. We've never tried to do that. I don't know what's realistic, but there's some ideas being generated, including maybe even hiring off-duty code enforcement officers or law enforcement officials to help us respond to complaints, with the idea being, again, that we've got a limited time frame to try to turn things around for the county, and really almost in some ways every day matters in terms of being able to get that done. So Let me stop there, and I'd be happy to take questions about data or about the public health order or other things.
Right. Dr. Douglas, before I've got a couple people in the queue, but one thing that Max brought up with some numbers he was giving out to the public at the beginning of his presentation, that this morning when we reported to the chamber, the Adams County number was 379.2. That was, I pulled that number at 8:30 this morning. At 6:30 tonight, I pulled the new number. It went from 379 to 395.8 since I pulled the number at 8 o'clock this morning. And our positivity rate went from 8.3 to 8.5. But I also saw the same jump, not as big, in Adams County from what we reported earlier this morning. So we're still seeing the numbers rising daily in both counties. Now, as you pointed out earlier, Jefferson County is not rising at near the rate. And I did confirm about midday today what you said earlier, that Adams County is the highest rated county in the state. Let me turn to questions from a couple of the council members. Councilor Seymour.
Thank you, Mr. Mayor. Thank you, Doctor, for being here today. I want to compliment your staff on your website. It is by far one of the best that I have to look at. But I have some questions here, and I listened into a call a couple weeks ago, and it sounded like there was, and you can correct me if I'm wrong, some frustration, the fact that the state is not looking at any back-end data. And I want to ensure my colleagues and the public that these are people we're talking about. But when we're talking data, we have to use data throughout the entire extent of that. So when we're talking about that back-end data, it seems that you know, our 7-day moving average on hospitalization is dropping significantly. At September 1st, we were at 0.661. We did have a jump up in the first week of October to 1 on that 7-day. And then as of last Friday, using that as the baseline, we were at 0.447. And then this, you know, the number of beds utilized on Friday was at 4.5% of the entire beds in the county, and I realize there's crossovers in that. But how are we going to be able to get the attention of CDPHE on these back end numbers as this changes through the virus?
Let me just clarify. When you use the term back end numbers, are you talking about things that happen after the initial infection, like hospitalization, or?
That's correct.
Well, good question. I have had a conversation with Douglas County this afternoon. Their rates are a lot lower than Adams County, but they are increasing about the same topic. I think what's going on is that the structure we're using, the dial, which was, by the way, based on the White House Coronavirus Task Force recommendations, a group that included number of local elected officials, Commissioner Odoricio, Mayor Williams of Arvada, kind of worked on this with public health directors in the state. I think what we came up with was certainly better than what we had before. I think it was a work in progress. I think that it didn't pay enough attention to, I tend to call it severity data, like the really bad stuff happening. We think testing numbers can be influenced by just how much testing you're doing. We think hospitalization numbers are probably fairly constant, representing biologic reality over time. And I frankly thought that with more testing and more cases, it would be smart to try to create some sort of accountability for hospitalizations. Now, as Max said, that was included in the metrics, but the problem was, as I saw it, it didn't really allow us to adjust cases for hospitalizations. That is, you're diagnosing a bunch of people who aren't very sick. Shouldn't we try to, if we're going to do, personal or school or business restrictions, shouldn't we try to have some measure of things getting worse in terms of severity? This is still a work in progress. Douglas County, and I'll frankness, put forward a proposal to have a pilot in Douglas County because their rates have been just really fairly flat throughout the summer. Preliminary response today is the state thinks that's too complicated to implement across the state. I think there's interest in continuing to have that conversation. Now, I would say you're obviously pretty data focused. I don't know, were you getting the hospital 7-day incidence rates? Were you getting those off our website?
Yes, that's correct.
Because what you read isn't exactly what I'm seeing. I think you had something in early September and then something that was lower now.
I'm looking at, let me pull up this current one. And let me
We're in the
pull out
same
Adams.
place. I think you said the most recent point of the graph was 0.698. Is that right?
On that most current on that on the 7-day moving was 0.447 as of the 18th for 7-day hospitalization.
Okay.
Yeah, it was the daily hospitalization rate per 100,000 7-day rolling data.
Yeah, it's interesting. I'm looking.
I'm sorry, it's 0.698. I probably hit
Yeah,
the
okay.
little. It's tough
Yeah,
on
that's
a
fine.
on
Okay.
a iPad.
All right. No problem. So we're on the same graph.
Yes.
Let me say two things about that. First of all, we're both reading the same number, but as you may notice, that part of the graph has got a gray background to it. And the gray background is because hospitalizations are delayed in reporting. And we gray that out. We have a tiny, hard to read footnote that says current week data is incomplete. And that's because we have these delays. If you go back to where we think the data are probably pretty solid, the 14th is the last one. And our hover doesn't really show it, but it looks like it's about 1.25, which is, we could be moving down, council member, as low as that most recent number suggests. But every time you look at this, the gray stuff is going to look lower. And it's because it's incomplete. And it's possible it really is going down, but I think it's premature to say that at this point in time. Nonetheless, I will agree with the notion that even in Adams County, which has the highest hospitalization rate of our 3 counties, the case rate is substantially higher. And I do think that the state has said they are willing to reconvene the group. Again, that included Commissioner Odoricio and Mayor Williams to rediscuss this. I haven't heard a time frame for when that's going to happen. So that's a lot of words. I don't know that I really answered your question.
You absolutely did. It's that the most important thing is we continue to have a discussion. If we all knew everything about this at the beginning, we wouldn't be here anyway. And so there is changing, and I appreciate that because these are the numbers that I look at every day, and I overall trend on the hospitalizations, and it's still sad that we have deaths on an almost daily basis, but those have dropped significantly too. The positive side of this, though, I look at our Westminster numbers that your people are doing, and it's observational. We know that, but over time, we're above 90% or so as far as mask compliance, and so our residents are complying when they're out in the public, I should say, too. So, and that means that more likely our businesses are complying in some cases under threat of license, but that is what it may be. So I appreciate your time tonight.
Yeah, I just want to say one thing about the masking data. Westminster really has been a high performer, and we really appreciate that. I do think your observation about compliance in businesses is probably likely correct, but it may be that because I've been so careful in the grocery store that when I come home or when I go to my friend's house, I'm less likely to be careful. And that's why we're seeing the social gatherings sort of show up. And one of our messages really is mask wearing in lots of different settings where you can be in contact with other people is important.
Mayor Pro Tem Sykes.
Thank you so much, Dr. Douglas, and thank you, Counselor Seymour, for those questions. That did clear up for me that the gray portion of that graph is really just indicating incomplete data, so it's not to be misread as a trend. I wanted to ask real quick, because I was on that same call, I believe, with Counselor Seymour about a week and a half ago now. And what I heard loud and clear from that is hospitalizations are a lagging indicator. So it is hard to determine, how sick people are getting right away. Can you remind me how much of a lag is there if someone's going to be hospitalized from positivity testing to admission? Is there a number for that?
We don't have a good generated number because we don't actually find out about a case we often don't find out about a case who's hospitalized until they actually get hospitalized. My impression has been that, some people, I think the real question is how long is the average person sick before they get hospitalized? They may not get tested. And it looks like that infection typically progresses over a matter of 3 to 5 days or so. Now, there can be people who get sick later than that. You may remember when the president was hospitalized, people talked about the fact that there could be a second time period when you could begin to get sicker again. And we think some people do get hospitalized during that second downturn, but it's generally speaking within 3 to 5 to 6 or so days, maybe out to 7. Kind of cautious rule of thumb, I've sort of deemed hospitalization to lag by about a week, maybe a little less than a week. I think if you're getting really good care, because one of the criteria for hospitalization is poor oxygen status. If you're getting good care and your pulse oximeter shows a low reading, and I think we're doing a better job of getting people checked in, that may have shortened that pre-hospitalization timeframe.
So that's good news. That's great to hear that while we're been experiencing kind of a week over week increased incidence of positivity, we haven't seen huge spikes in our hospitalization.
Exactly.
But with that said, and perhaps I'm incorrect, but I thought I remembered from that call with Counselor Seymour that you mentioned that it was modeling to have full hospital beds by Thanksgiving if we were not able to lower our positivity rates.
Yeah,
is that correct?
That's what I had heard from the dean of the school public. Is this a call when I was talking? Are you?
Correct. Yes. Yeah.
Yeah. Okay. All right. Fair enough. Yeah, that's what
Okay.
A couple of weeks ago the dean was saying. One thing that they've adjusted their model. Probably the biggest improvement we've had in COVID has been taking better care of people once they get in the hospital. And what that's mean is fewer people are dying. The kind of stuff the president got, sort of medications, is really making an improvement in people's both survival, but it's also the duration of hospitalization. And what the School of Public Health team is doing is modeling shorter duration of hospitalization into their model. Because if you stay in the hospital for 2 days versus a week, it makes hospital capacity less tight. And I just heard this morning, I haven't seen the dean present this, is that the current estimate is, I think, Christmas Eve, where the hospital capacity gets overwhelmed. So I haven't actually seen that data, but that's what I heard on a call with the State Health Department today.
I think that's an important piece of information because that does let us know the stakes involved. So, thinking of our hospitals being overwhelmed is terrible. I just received, while you were speaking, a text from, my children are in Adams 12 school district. And we just got a text, all parents in that school district, that Superintendent Godowski is proposing to go back to remote learning for 6th through 12th grade, and that will be voted on Wednesday night. And so last week I made a plea to our community to really do everything we can to try to keep our kids in school and to try to keep small businesses open. And I think those are really, in and of themselves, important goals because our local economy can't, I hate to think about what another shutdown would do to our local businesses. And I don't like to think about the impacts of, you know, the change in learning models. But hearing about overwhelmed hospitals around the holidays is really terrifying to me. So again, I'm going to make a plea that we do everything we can to honor the mitigation plan to try to avoid those scenarios from happening. Not just the shutdown, but actually the potential impacts. So, but thank you for your presentation tonight, and I have no further questions at this time.
Yeah, I will say one more thing if I could, since you mentioned Adams 12. I mean, they're experiencing what we believe really all the districts right now are experiencing, which is lots of disruption due to teachers and kids who are infected, what appears to be in the community, but not in the schools. We actually think the school itself is a pretty safe environment given all the effort that's been undertaken. But what's I know giving Chris Godowski headaches is the constant disruption of class comes in, gets put out for, you know, a week, 2 weeks. And I can't speak to his thinking, but I know that's been an early issue that many of the districts have experienced.
Well, I know everybody is doing everything they can to protect our kids, and that they all are educators who value, you know, best possible educational outcomes for our children. And so this is no way a criticism. Obviously, I trusted that they were doing everything right, or I would not have sent my 3 children back to school in the hybrid model for my older 2 and full day for my younger. But you know, this is hard for everyone in our community. It's it's never welcome news to have change that impacts those that we love the most. So.
Councilor Vols.
Thank you, Mr. Mayor. And Dr. Douglas, thank you for being here and talking to us here in Westminster and answering our questions. We have a really good team who've been keeping us up to date, but then having you here really helps take it to another level. So thank you very much for taking the time. I have a question about, there's a little bit of ambiguity about public safety and where they fit in. And this may be a question at some point I'd like to start with council. I was contacted over the weekend about a very large party that happened in our city. And when the person, it was over 50 people, they estimated, and no one had masks on, no social distancing. And that's how this is spreading. And they called the police, and the police response was, we don't do that. We're not involved in that. So I understand that. But I think what happened was Adams County Sheriff sent a deputy over and kind of helped break up the party. But I think we have to get a hold of it. If someone calls in, I think we're going to have to figure out who do they talk to? Is there someone to talk to? I know we don't issue citations, but is there a way to educate people and send them home and say this is not appropriate? I guess I have a little bit of concern when I heard that this weekend that we're not enforcing through our police department, and that's fine. But is there ideas for enforcement or ways to take that to the next level?
This is hugely frustrating. I don't know, you probably may have heard, was the party you referred to this weekend, or was that a different weekend?
It was this weekend that I got contacted by some folks who were upset because the party just kept going. Yeah,
I got contacted about that through Ray Gonzalez as well.
Same people probably.
This is really a problem that we don't have a workforce that can go out to a party like that at 10 at night. We do think and again, law enforcement is overextended. I don't know whether the police response was because they were overextended, which is very understandable, or whether it's because it's just not been agreed that that's part of what is in their, area of attention. I do think, and again, we're actually trying to set up a call tomorrow to involve at least the sheriff and ideally some of our local police departments to talk about sort of here's where we're at. What options could we pursue? I mentioned earlier the idea, the county has indicated they may have some CARES dollars that could be used to pay off-duty law enforcement officers and or off-duty code enforcement folks to help us do quick responses to that sort of thing. I don't know if that's pie in the sky or could be a real a solution. I live in Denver, and I do know that that's what they're doing in Denver. It's a unified city county government. The mayor said, we've got to bring things under control. I don't want to close the restaurants. I don't want to hurt business. I need are, this is all hands on deck. And as far as I know, they're not using on-duty police, but they are using off-duty police to help them with that. And I can't tell you how well that's working, except to say that they've had a tighter organizational structure than we have. And to me, that's one of the most promising ideas about what I completely agree is a huge hole. And I hear about this not only with private parties, I hear about this with a responsible restaurant owner who's playing it straight, and his competition down the block is not. And we get complaints about the competition down the block, and our ability to respond and do things fast is not great as a public health department. So I think it's a big issue. And again, I hope, going to have a productive discussion about this tomorrow.
Well, good to hear that. I do think it is a huge hole that we need to think about. So thank you for that, and thank you for that answer. I agree with Mayor Pro Tem Sites. We've got to do everything we can, and some of these parties, these personal gatherings, are where there are some problems. We have to ensure that we're working with our businesses. We have to do everything we can to allow them to remain open. So we've got to put a stop to these kind of issues. So thank you, and I'm glad to hear your meeting on that and talking about tomorrow. I hope our city here in Westminster gets a chance to loop in and at least hear what's going on and what the ideas are. So thank you very much.
Councilor Scully.
Thank you, Mr. Mayor. Thank you, Dr. Douglas, for being with us tonight and going through our questions. I know that we have a lot of them as a council, and I just appreciate your willingness to listen to us and answer our questions. I think we're all very concerned with the numbers going in the direction they're going at right now, and trying to figure out how we help our residents understand that this is not a sprint. This is a marathon we're in, and we have to keep working hard at what we're doing, which means, wearing our masks, social distancing, making good choices about how many people we're hanging out with, where we are willing to go in public. And so I appreciate you being here tonight. Thank you so much. I do have some questions though. You talked about the hospitalization beds, and the rate seems pretty low right now, which I'm so very grateful for. I don't want to see that number increase if we can avoid it, but I understand that may be just part of the cycle. I was curious of how many, is that just a COVID bed number, or does that include other hospitalizations, surgeries, heart, emergency admittance, anything of that sort, or is that just overall?
So we track on a couple of things. Newly admitted people to the hospital. That's what that curve that we were talking about earlier was. Number of people with COVID in the hospital at any one point in time. We don't have that on our dashboard, but the state does show that for the state. But the real issue is hospital capacity, and in particular ICU capacity. And that is capacity after you've taken care of everybody who needs it. So I think, for example, right now, I think in Adams County, it's 79% of the ICU beds are full. That means 21%, and that's full of whatever, COVID, car accidents, heart attacks, et cetera, et cetera. And the 21% is not just for COVID, it's for whatever. One thing I will note that, back in the springtime, we pretty quickly stopped doing elective surgeries of all kinds. And elective meant, oh, you have newly diagnosed colon cancer. Sorry, you have to wait until we can fix you. You don't want to wait on cancer, but that's not life-threatening in the next minute. And that's why those sort of things were delayed. So some of what's in the ICUs right now are people that have got elective, not really, but it's not emergent in the next hour, that are being delayed. So that's the kind of thing that could buy us more hospital room, but those are the kind of things we don't want to delay. So anyway, long answer, yes, it's all comers that are part of the calculation.
Okay, now that's very helpful. So I know that the old St. Anthony North Hospital was an overflow. Is that still in place, or did we let go of that as our numbers decreased?
I cannot tell you that for sure. I do know there's been some reconsideration of the alternate care and overflow facilities. And I don't know where that is, but I can find
It's still
out.
there.
Is it?
Okay.
They just did a trial run down there about 3 weeks ago, just looking at it, making sure stuff is there. Corps of Engineers is actually running that, Councilor Scully.
Oh, okay, okay. And then, it's not just a concern too of our hospitalizations. And I mean, that is a huge consideration, but it's also of the people that are working in our hospitals, those frontline people who we don't want them to burn out, and we want to make sure we're protecting them. And so I worry about that as well. Do we have any handle on how we're doing with our frontline workers that are in the hospitals? Are they managing taking time off? Are they overworked? Are they feeling overwhelmed right now? Or we're pretty good right at this moment, worried about where we may be?
I think you nailed it. I think we're pretty good at this moment, worried about where we could be. The part of the worry was PPE, because that's where some people got sick. Right now, that looks a whole lot better. Part of it was, people working 18-hour shifts. That's happening a lot less now. In fact, if anything, some of the hospitals have seen their bottom lines really hit because of the reduction in elective procedures. People were furloughed. And I think we could get bad again, although I think the PPE situation is a lot better. We could get bad again from a stress and overwork perspective, but we're not there at this point.
That's good to know. The other number that I've heard people want to know is the recovery. Do we have any idea what our recovery rate has been, or what our recovery number has been? I don't want to put too much optimism out there, but I think people are interested in the success too, that this mitigation we have done. I think that we really have to be proud. I know we have lost a lot of people, and it is tragic and it is sad. But as a whole, we've also done really well because we have been diligent in wearing masks and social distancing, making good choices, making sure that people who were sick were isolated quickly, that we haven't spread this as fast and as rampant as we first anticipated it might spread, that maybe we have slowed it down and we have solved some of this a little bit. Do we have any idea of what our numbers of recovery are? I know that the world, the WHO often publishes a recovery number, but I've noticed I haven't seen one for Westminster or Colorado.
I'm not a big fan of the recovery number, Catherine, because I think they're frankly just sort of estimated. I mean, the way you would really do that is to say, because there's no way we've had, gosh, I've lost track, over 7 million cases in the US, maybe over 8 million. And there's no way we can track on the status of all those people. What we can say is that we know how many people were diagnosed, which is, by the way, probably an underestimate. We know how many of those died. And obviously, if you die, you didn't recover. We know how many of the people who were hospitalized got out of the hospital. And so we can calculate a pretty accurate, if you didn't die, then, the death rate is now down to probably not even 1%, the more people we're diagnosing. I will say that we are realizing that not everybody who gets well gets back to normal like that. There's this long thing where people have prolonged respiratory impairment, prolonged neurologic impairment with brain fog. People with underlying heart disease can have prolonged cardiac impairment. We don't have a good estimate on that now. I heard one doc in New York City, they've got a COVID long hauler clinic, talk about maybe up to 10% of people may fit into that category. So we don't, in summary, measure recovery very precisely. We do measure the death quite precisely. I would agree with you that, the original models from the Imperial College in London said if we didn't do anything and we just sat back, we'd have, 2 million deaths. So obviously we are far less than that. And that's very much to, feel good about and to let all of ourselves feel some degree of pride in. But, honestly, we do have one of the highest death rates per population in the world. Not the highest, but one of the highest. And so I still look forward to figuring out how we can do better. And especially into a tighter time of year.
And I think those are very good points. And I appreciate your opinion on the recovery number. I don't disagree with you. I've just had many residents who have asked me, and so I thought it was worth asking the question and getting an answer because I know that they're listening in tonight. The last question I have, I'm concerned about, we're hitting flu season, and flu season combined with COVID, it seems like a really bad mix. And I will tell you, I went to get a flu shot last week and they were out. So I'm patiently waiting for a new batch. How are we doing on the flu? Have we had any numbers yet? It might be too early. I know that they're encouraging flu shots. Do we have places where those are maybe more available than others? Are we also putting that information out with our COVID information, that is a good way to also help yourself be more protected, not from COVID, but it would be easier to rule out the flu if you've had a flu shot. So are we doing any kind of work with that?
Yeah, we're hugely concerned about everything you just mentioned. We've been messaging about the importance of the flu vaccine really since June. We did get it a little earlier this year. I think the combined manufacturers produced about 50% more than usual. The average in the US in terms of how many people get the flu shot, since virtually everybody over the age of 6 months is supposed to, is about 48, 49%, which is pathetic. And we thought, gosh, if we're ever going to do better, this is the year to do better. The early returns based on some of the experiences you've described, we don't have any really good comprehensive data on shortages, nor do we have really good comprehensive data on this point of what % of people have gotten a flu shot. But the anecdotes seem to be that many more people are getting flu vaccines. We had a clinic blocking on where it was in Adams County about a week ago, and we had lines going around the block, which we've never seen before when we've done clinics like that. I wish I could tell you where to get your vaccine. Our clinics still have them if you don't have any other options. And I think many pharmacies do or are getting orders back in. So it may be a matter of calling around, but please be persistent. We have not had a bad year now. This may not be a bad year. The Southern Hemisphere usually is a kind of a early warning of what we're going to experience, and they had a not bad flu year. It's either because the vaccine is a better match for the circulating virus, or because the mask wearing gives us this really important added benefit of flu prevention. I think it's probably some of both, but that is yet another reason to be wearing masks.
Wow, that's a great point, and I thank you very much for that. Thank you so much for being here with us tonight, Dr. Douglas. That is all for my questions. Just a reminder to everyone, wear your masks, social distance, make good choices.
All right, Council, I'm going to go to a couple of more, and then we're going to try to let Dr. Douglas go. Councilor DeMott, you're up.
Thank you, Mayor, and thank you, Doctor, for joining us tonight. I will say, based off of the rough numbers, that the city of Westminster is 113,000 people. At our last report of deaths in the city, you're at 0.00036283%. So just in case anybody wants to actually know what the death rate from this is, those are real people, and each one of them mattered. But I think it's also important to have accurate numbers like we've heard earlier tonight. One of the things I would like to ask you is, the idea we've heard throughout the year of herd immunity and the severity of, and really the reason I always ask about hospitalization and what those rates are is I'm curious about, are we seeing this become less damaging to human beings as it cycles through the year? And, it's been through multiple human beings as it's passed from person to person. Can you speak on that at all?
Yeah, it's a really important topic. I've been a lot of discussion about herd immunity. Because I know the mayor's looking at the clock. I'll say two things. First of all, there is no evidence at this point that age-adjusted severity, at least in terms of are you going to get hospitalized or not, has dropped. So we do know that population-adjusted hospitalizations have dropped, but we believe that's because younger people are getting it and older, more at-risk people are being more careful in protecting themselves. But the concept you're raising is the virus becoming less virulent? And the answer is, at least right now, although we do know mutations are happening, we don't think they're reducing virulence. Now, sometimes that does happen. So it's certainly possible that could, but at least at this point, it doesn't appear to be happening. herd immunity is another important question. Herd immunity, is based on a cow metaphor. If all my cows are vaccinated, or most of them are vaccinated, then the ones who aren't will be protected. It actually grew out of vaccination campaigns and observations, although we can achieve herd immunity through natural infection. At this point, it looks like best population estimates are no more than 10% of us have been naturally infected. There are some hotspots, Chelsea, Massachusetts, for example, that were up to 30%. But the average on a state basis is more like about 5, 6, 7%. And one could, in the absence of a vaccine, and every one we're testing now could fail, by the way. They look really good, but we don't have any guarantee they're going to work. Ultimately, we could work our way through society. I think the likelihood of us doing so without a pretty close to the number of deaths that we've seen already proportionally is not very high. In other words, we could get there and could get to what's estimated to be 60 to 70% of us needing to be immune either by vaccine or natural infection. But that's a pretty long way to go from 5, 6, 7%. And it's the idea that if we can just keep the folks at greatest risk sequestered, we can all go back to life. And that's pretty challenging when we realize that about 30% of the population is either over the age of 65 or has one or another underlying illness that puts them at greater risk for serious outcomes. So should those people be careful? Absolutely. But my own view is we're probably going to get to herd immunity faster through a good vaccine.
Thank you for that answer. Well, the other thing that I just quickly want to ask you, and then I have a couple of comments on what I've heard tonight, is as far as, well, you've kind of already answered that. That's fine. I guess the other two things I would say is, as far as the flu vaccine, I got mine last week. So I know a lot of our local stores have them. Local wholesale market for sure has them because I got mine while I was doing my grocery shopping. So I would encourage people to do that as well. I think a lot of to your points of certain age demographics, those are typically the age demographics they really recommend get flu vaccines as well. So being smart is important. I will tell you all that I'm very concerned about the idea of trying to police people and having people calling their neighbors and stuff. I think we should make wise choices, follow the guidelines. However, I won't advocate for in a free society going to people's homes and ticketing people when they gather in their own private property. I think that we're getting to a point where we're looking at infringing on people's rights, and that's not something that I'm looking to be a part of. So aside from the fact that we don't have the manpower, nor do most of the sheriff's departments have the manpower to do what you're talking about, even if we had a right to do that. So that's just my 2 cents about that.
Mayor Pro Tem Sites, would you please wrap up this? Then we'll let Dr.
Mine's actually a very easy question for you, and it's really just the logistics around the indoor personal social events. So for example, I am a family of 5. With the way the new public health order reads, would I not be able to have anybody over indoors, or does my family count as 1, or does it count as 5? And asking for a mother who wants to know about Thanksgiving. So, and I'm sure there's a lot of other people in the community trying to figure these things out.
I'm embarrassed that I'm going to have to look this up. We spent about an hour debating this very issue.
I thought it was, I'm sorry.
I'm pretty sure the way we left it was 5 non-household people. So your household counts as 0.
1. Oh, okay.
Yeah. I'll tell you what, you're looking so surprised. I want to be sure. Ask me your other question. Let me look this up while we're talking.
That was simply the question is I'm getting neighbors asking me, how do they plan for the holidays? Is 5 including their family, right? So if they're a family of 3, they can invite 2 folks over, or can they invite 4 other folks over? But what I'm hearing from you is they might be able to invite 5 folks over.
Yeah, I listen, because I know the public is listening and I don't want to create total chaos. I will, how about if
anything, you're making me feel better that it wasn't immediately clear for me. So
yeah, really sorry to be so stupid.
No, that's fine.
I'll text you guys back and you can announce the answer once I get off. I'm sorry about that.
Oh, that's fine. Thank you so much, Dr. Douglas.
Okay,
John, thank you for your time. I know you've had an extremely long day and you've got another one tomorrow, so we greatly appreciate. And to your point, the discussions from CDPHE with the rapid increase we're seeing in Adams County, the potential that we could skip level 3 and go to stay at home is very concerning. And I know that is in your team as well. So we're encouraging anyone and everyone where we can to get this problem resolved and help us get these numbers down before that decision gets made.
okay. Hey, Herb, I'm gonna email you my answer because I don't have Anita's cell phone.
That's
So-
fine. Just send it to me and I'll read it all over the phone.
Yeah, good. Thank you.
All right.
Have
Good
a
night, John, and
evening.
thank you.
Yeah, take care.
Mr. Tripp, let's move to the next item, please. I think you had a question from Councilor Demott.
I did, and Counselor, I hope you don't mind if I just queue it up. We've had inquiries from a number of residents with concerns about people camping overnight within open space in other city-owned locations. And due to COVID, we've been less aggressive in moving people out of those facilities. We reported that back, and I know people would like to know more about that. I'm not going to get into that detail unless you'd like somebody to do that, Counselor. I've got Jason Gink available to restate what we shared in some of the correspondence we provided, but I'll turn it to you in case you may have other questions or comments also.
Frankly, I'm just concerned that, I understand that there are extra rules and guidelines around the homeless during COVID. However, I'm getting quite a bit of concerns, and some of the concerns people are sharing, I think, are pretty valid concerns about some of the encampments that we're seeing sprout up real close to people's homes. I know that our neighboring cities have found ways to navigate this appropriately, and I want to assure that we're doing the same thing. Obviously this is a hard time for a lot of folks, including a lot of homeless, but oftentimes with these encampments, we see things like drug use and mental health problems, and I can see our residents' concerns about us allowing it to continue in open space. One of the residents who called me was talking to, kind of frankly shared, people don't get to camp in the open space for a reason. So, a lot of that surrounds safety for both the people who might decide that they, should do that, as well as the residents who live around there. And as we come into the cold season, I think that becomes an even greater concern for those folks that may be trying to, live in these encampments in our open space. So I want to, really want to understand our options.
Thank you, Councilor Demott. This is Jason Gank, Director of Parks, Recreation, and Libraries, and I sincerely appreciate the concern and the question and the follow-up. Typically, the City of Westminster does not allow camping in public spaces, and we typically do take action, as soon as we can, as soon as it's brought to our attention, and/or as soon as we find it, to address and follow proper procedure, which includes notification and then removal as need be to the site. However, during COVID, things have changed pretty significantly in that regard. We have been following the directive of the CDC, which is to refrain from breaking up encampments, that the types that we're discussing. Unless, of course, there is a safety hazard at the site. And in fact, that's occurred 3 times in Westminster through COVID, and we have taken action and removed 3 sites due to safety issues. The concern from CDC is that by breaking up homeless encampments is that there's a likelihood of accelerating the spread of COVID into the community, as well as impacting populations that may be most vulnerable to complications of COVID. So what we do is we work hand in hand with our police department, typically the Parks and Recreation Libraries police staff, as well as our homeless navigator, and we go to our sites once it's reported and or once we find it ourselves. We make contact, we provide services, we provide alternatives. And I know to date, we've put 14 individuals, unique individuals, so non-duplicated individuals into hotels through our hotel voucher program. And so those were successful for 14 individuals. But otherwise, we do an assessment of the site. We provide as many service connections as possible. We do document and we do tracking of the individuals at our sites. And we give specific instruction as to what we're doing and what we will do based on our regulations that are in place. But Councilor DeMont, you're absolutely correct in that typically the city does not allow encampments to occur. However, the CDC has asked jurisdictions to refrain from breaking up encampments. And I know you mentioned our fellow jurisdictions, and by what we're tracking, I'd love to hear more if you have that information, but what we're tracking through our homelessness efforts through Kate Scarbeck, RJ, as well as the functions that I'm in with local directors, is that everyone is following the same guidelines from the CDC. And when they are removing encampments, they're doing so in the manner that Westminster did, which is to follow appropriate protocol, but they're doing it specifically because of a hazard situation. In the case of things that certainly go against what we'd want to see on these properties. Of course, we're also awaiting any change in guidance. Because again, the only reason we're not moving encampments along is because of the CDC guidance.
Understood. And I guess I would have 2 points. And I mean, I really wanted to bring this discussion to the forefront with my colleagues and see if anyone else had concerns they wanted to share. I know at least a couple of you have shared concern in one-on-one conversations with me. One, I had heard from a resident who also is a employee of the city of Arvada. And from what I'm told, they are doing a little bit more than what we're doing, is what I'm told. And whether or not, that's 100% accurate, I don't know. I don't deal with the city of Arvada. So maybe if we have anybody over there that we could validate that against, it would be interesting for me to know. The other thing that I understand the CDC guidelines and somewhat the idea, but I also think that if you allow one of these encampments to go too far, it almost seems like it's self-defeating against what you're trying to accomplish by not breaking it up. I mean, we just heard a lengthy discussion about how people shouldn't gather in their own private property with more than 5 people. So if one of these encampment grows, like, what's the safety limit? Is there a limit where we say, oh, this encampment's becoming a place where there's, a dozen or more people? Are we then saying this is a risk to, become a hotbed of COVID? I'm trying to understand really the guidance besides just not wanting to move people around in case they're infected.
Jason, you
Councilor
have any?
DeMont, Jason Gang. Yes, I do. Just briefly, I just wanted to answer one part of that question was to say that based on our direct contact with Arvada's City of Arvada's homeless supervisor, so kind of a counterpart to Kate Scarbeck, the answer is yes, absolutely. They're following with Westminster's the same practices, which are really the CDC's. But certainly, Councilor DeMont, I certainly respect what you're saying. As people discuss how these things are happening, there may be some discrepancies in how they're sharing information, but Arvada is, as well as local jurisdictions, are following the same guidelines. And like I said, our city has, in fact, to date, because I asked staff based on today, we've actually removed 3 encampments for safety violations and concerns. And again, the second part of your question, I totally understand as CDC guidelines, as public health guidelines change, and we have restrictions on gatherings, such as gatherings in the outdoors or gatherings in the indoors, then how does that impact, how does that impact our decision as far as that size of encampment and whatnot? But I also, one more last thing, and I apologize, one more thing to add is that we do have some numbers as to how many folks we're seeing in camps at a time. And generally, the largest camp that we've seen is 7 people at a time. That doesn't mean any given time that people are walking by or what have you, that it gives the appearance of more than that. But based on our staff's tracking, because they do make contact with all of the camps and and homeless individuals in the community as best as possible. The largest camp we've seen in Westminster so far is 7. We do have a trigger based on best guidelines, is that if there is a larger group than that, such as when the number hits 10, additional things come into play, but it's more around hygiene and care and those types of things.
With that being said, the last thing that I would ask is, one of the big frustrations I've heard from community members is that, when they contact the city about encampments and the concern for safety, that it seems like the line is basically, hey, this is what we're being allowed to do per CDC guidelines, and there's nothing we could do. I understand that to an extent, but we also need to make sure that there's safety being provided for everybody in the city, and that includes the people that are experiencing homelessness. So however we can address the concern of safety, whether that's, hey, we're letting them know how we keep an eye on encampments that spring up, or patrol, or whatever that is. I just don't find it to be an acceptable answer that, hey, this is the way it is. Sorry, folks, that you're concerned, but it is what it is. So I would hope that we can figure out a in between while we deal with this hard time until we get to the other end of it.
And Councilor DeMont, I really appreciate that, and I do want to reassure you of one thing, and all of council. Every time we have a camp reported, each and every time we make immediate contact. We're very fortunate to have a homeless navigator position, and many other cities are doing the same. That navigator position goes out to the site, makes immediate contact, and talks about our rules and regulations and expectations. And I also want to just put, for the folks that may be listening to the session, our homeless navigator can be contacted, and I want to just put his phone number out there, 303-658-2205. Again, that is 303-658-2205, RJ Toledo. And he's immediately responsive to getting out to those sites and tracking. And I also want to reassure you that while we are allowing encampments to happen, anytime there's anything such as materials and such as drug paraphernalia or unsafe conditions or damage or destructions to property, we are immediately taking action. And what immediately taking action is to notify them that they're to evacuate within no more than 24 hours, and we take action.
No, I appreciate that, and I think that there's a lot of credit given to both the previous council and staff over the last, decade or so, that they've really addressed this in a lot of good manners. And it's such a complicated, in my mind, multifaceted issue. I don't want that to be going unsaid, and I'm glad that you brought it up. And hopefully, if you could have the city, just in case anybody's listening, if the city would be willing to share our resources. I know we have a lot of them, and it's a good reminder for folks if they experience somebody who's experiencing homelessness at any level, that they know what resources are out there. I would just share an experience I had, and it was actually in Arvada this weekend. We were out with a group of people doing some politics stuff and ran into a young lady with her daughter who was homeless. And, I saw some people treat her pretty poorly. We had a nice conversation with her and her cute little baby. So the reason I bring that up is I would remind people too that you don't really know what those folks are going through. So although I want to make sure we're addressing this as best we can, I would ask people to act with some empathy as well, because you never know, it could happen that quickly to you that you end up in a bad circumstance. So, and sometimes to no fault of your own. But I appreciate the conversation, and I know that you guys will do what you can.
And Councilor DeMont, one final thing that I just wanted to correct is that if someone is experiencing an immediate threat and or just needs immediate response, 911 would be the appropriate phone number to call. The number I gave is for our navigator who works 40 or more hours a week and may not be available 24 hours, but certainly 911 for our police department is.
Great, thank you.
Councilor Vols.
Yeah, I just wanted to also add my voice to Councilor DeMont. I have received a number of contacts on this subject, and it's very important. And sadly, this happens to individuals, and I think kind of where we are right now, it's probably going to happen more. So we do have to have sympathy and empathy for families and people going through this. the people who contact me are very concerned about safety, and I think they just don't feel safe when there's an encampment and they're, going along the trail. So that's where they're coming from. One thing I would ask is that we follow the people where we forward these on to the city staff, follow up with the neighbor who reported it, the resident who reported it, so they know. Because I think a lot of people don't know the protocols. We are hearing it now, but people who report it, it just kind of goes somewhere, but they don't maybe always hear all that, and maybe they do, and that's good. But if we could work with them, let them know we're working on that, do a little follow up so they don't think nothing happened, because we usually hear about it a couple more times. But I also want to say the fact, I think it's very forward thinking, and I'm happy that we were part of this. Having a navigator here in the city and being involved in this, I think is tremendous. And I think right now we're seeing the fruits of that effort. So thank you for everyone involved in that. And I just want to, most of the issues have been covered already. I just want to kind of add my voice to Councilor DeMott on doing what we can, and then following up with the residents who have concerns and just letting them know what you're telling us, what we're learning tonight as well. So thank you.
Councilor Seymour.
Thank you, Mr. Mayor. Councilors DeMott and Vols have already stated what I was going to say, so I'll withdraw.
All right, Councilor Scully.
Yeah, I just wanted to join in the conversation and say that 911 is the perfect number to call, but 211 is a great number to use to help people connect with resources such as housing and shelter, food assistance, crisis and emergency health services, mental health. So 211 is often a number that's given out for people who are experiencing homelessness or are about to experience homelessness.
Okay, we've had a request for a short bio. Trying to move on to get into our next subject, which will be the Rocky Mountain Metropolitan Airport. So by my clock, it's at 7:48. Let's just take a quick 10-minute break because the next couple of items could be lengthy. So let's go ahead and reconvene at 8 o'clock.
Oh, really?
All right, Ms. Parker, if you could take the roll. I thought I saw Counselor Bowles already back, but his camera may be off. So if you would take the roll, it's 8 p.m. and we'll be returning from a short recess.
You bet. Mayor Atchison,
Yes.
Councilor Demott.
Here.
Mayor Pro Tem Sites,
Present.
Councilor Seymour.
Here.
Councilor Scully,
Here.
Councilor Smith,
Present.
and Councilor Bowles.
Here.
All right, Council, we have one other open session item. This is a discussion regarding the Rocky Mountain Metropolitan Airport. And after that is concluded, we do have an executive session still left for tonight. So for the time being, we'll go ahead and bring this one forward. Mr. Tripp, you have a presentation on this one?
Just a summary, Mr. Mayor. Mr. Mayor, Mayor Pro Tem, members of council, we provided you a written staff report on this issue. For the purposes of those people listening, I'll just do a quick summary. And that's to say that this is concerning the Rocky Mountain Metropolitan Airport and a concern that neighbors in the surrounding communities have about increasing noise as a result of the traffic at the airport. Staff participated over the course of the last year and a half or so in a staff level survey and study of how to structure a community noise roundtable, a group that would monitor noise and would work with the airport in keeping an eye on this subject moving forward. Of course, our community is one of those impacted, and we have residents who have expressed some concern about that in our office, and I'm sure to you as individual council members. So tonight, what we have in front of you is two questions. Number one, as a city, do you want to participate in the community noise roundtable? We would recommend to you that as a community, we think we should be at the table involved in this. And then the second would be whether you want to be represented with a member of your council, or whether you'd like us to continue to staff this with the folks that have been involved in creating this framework. So we have staff available to answer detailed questions if you'd like more detail, But again, I would just reiterate, we do think we should be involved. And then it is really your choice as to whether you want a council member to participate and be supported by staff, or 2 council members, or if you'd like staff to work on your behalf in this regard and come back and report to you as often as you'd like. Thank you.
So Don, a couple of questions so that might help council make the decision is, do we know when and how often this group is going to meet?
I think this is being taken to the jurisdictions right now. I would expect that the roundtable would probably be beginning before the end of the year. And I think one of the things they'll do is once the group is formed, Mayor, they'll begin to talk about the goals for the group and how often they'll meet. And I would think they would attempt to work with folks' schedule depending upon who's been appointed. At this point, not knowing who exactly is going to be attending, there's nothing definite set up as far as I'm aware.
From my understanding, because this roundtable has been discussed for some time now, the roundtable, even when it's formed, has no authority. All the authority, as I understand, belongs to the FAA, and compliance is still an FAA matter. Even the county doesn't have that authority. Am I correct?
I believe that's essentially correct, and I would ask City Attorney Frankel to weigh in if he'd like to. I do know, because I was involved in one of the early meetings, that the FAA actually encourages this kind of participation at a local level. So I would think that one of the functions of this roundtable would be to be the official group that the FAA would be listening to and working with in conjunction with the goal of having compatible noise levels at the airport.
Yeah, my question is related part to that, to Mr. Frankel, if you can. I don't want people to misunderstand what this roundtable is. They're not a rule-making group, and they don't have an enforcement authority as the roundtable. They still have to send everything to FAA for compliance. Is that correct?
That's correct. And the airport website, I believe, does have a tracking mechanism to track noise complaints. But you're correct, the FAA is the regulatory authority over the airport.
Okay. Councilor Demott, you had a question.
More of a comment. I think that it would still be good to participate, but I think having that baseline, Mr. Mayor, I appreciate you setting that out, that people understand what exactly we would be able to accomplish. However, I think that they set these roundtables up to take that input from the local municipalities and governments. I know when Mayor Pro Tem Seitz and I were at National League of Cities year and a half back, we actually met with the Department of Transportation, and I remember them actually having this very discussion about the airports in Colorado, and there were some other municipalities and local government there that kind of spoke about some of the roundtables that they had participated in. So it did seem like it probably is a valuable thing, and so I would be in favor of us choosing both a staff member and a council member if somebody has the time to take part in the roundtable.
Councilor Scully?
Yeah, I would also agree with Councilor Demott. I think we need to have that we should be a part of this roundtable, and I think that we should have a member of council and a member of staff who participate. I would be happy to be that person. I actually live in the flight line, so I sympathize with the residents. I'm hearing a lot of extra planes, a lot more planes. Most of it I have attributed to the fires. Because I know that we have a lot of planes taking off and leaving all day long to go and put out the fires, and I'm so grateful for the people who do that work. It is important work, but certainly I think in the last couple of years we've heard from more residents. We've seen an increase in the noise, and it would feel good to have someone from our city who could be a part of that roundtable, to be a part of that conversation.
Councilor Smith?
Thank you. I agree that we should have our constituent representation at this roundtable. I heard about this when I was canvassing both of my election cycles, and so and I continue to hear it now on council. So I would appreciate if we could have a member of council appointed to the roundtable. I think it would be beneficial to be a voice for our constituents.
Is there anyone other than Councilor Scully who'd like to throw their hat to be the volunteer to go attend these?
When would the meetings be?
They don't know. That's part of the issue that I was questioning, and they don't have any idea until the group is formed, and they have to decide that themselves.
I'm willing to help. Obviously I have work hours, so if it's during work hours, I'd have to relinquish my time to that, but I'm willing to help wherever.
All right, Mayor Pro Tem Sites.
Not interested in it being me, as I have a pretty full plate right now, but I'm supportive of having a representative on the roundtable. I think to the mayor's point, it's going to really behoove us to set expectations with our community about what we can and can't accomplish through this, and kind of where the ultimate decision-making authority is. I still think it's a good exercise to be at the table to advocate for our community, but I would hate for the person who signs up as a representative to feel to feel like there is an undue expectation of them to be able to affect change that might be out of their grasp or out of the grasp of this roundtable. So I do think we need to be clear about the constraints on it. That said, this is an issue that I didn't used to hear a lot about, and I do hear quite a bit about it now. And so it is a growing concern in our community, and I think having someone that can learn firsthand what's going on and be a conduit is of value. So thank you for stepping up, Councilor Scully. Unless anyone else, I know Councilor Smith, you mentioned maybe sharing the responsibilities. Appreciate that as well. But I do think expectation management with the community will be important.
Well, what I would recommend that since we have two people who have shown an interest, that Councilor Scully, if you could at least start to figure out when they're going to meet, and then work with Councilor Smith that if she can also attend, there is no reason that both of you can't attend. But I would anticipate these are probably going to be daytime meetings, as Councilor Smith alluded to. So the flexibility is probably more with your schedule than hers. But if she can help in any way, please include her. And
I'm happy to do that, Councilor Smith, and I will be in touch with you.
all right, Mr. Tripp, if you would then identify that Councilor Scully will be our lead person from council. Whatever staff you have assigned that's currently doing it, just have them work with them. And also Councilor Smith informed of the details of the meetings or any information you get from them.
Yes. I really appreciate this. I think it certainly adds more clout to have an elected official at the table in these sorts of encounters, but I think we can support you as a staff as well. So thank you.
Okay. Mr. Frankel, I think our next item is an executive session with the city attorney's office. So I'll ask you to read us in.
Thank you, Mr. Mayor. The executive session that is proposed for this evening is to consult with the city attorney for the purpose of receiving legal advice concerning the Stanley Lake Recreational Intergovernmental Agreement pursuant to CRS 246402 4B and sections 111.3C 3 and 8 of the Westminster Municipal Code.
And we've had a request for an executive session as defined by the city attorney. I will ask each member of council to confirm that they are prepared to go into executive session. Before I do that, I think I've got everybody. Yeah, I think so. We'll ask each member of council to confirm. Once we have transitioned to the executive session, I will not set a timeline. I think we've got plenty of time to get through it without having to worry about an extension tonight. Once we get into the executive session, we'll go through the similar process of the requirements for executive session at that time. So polling for the council to confirm you're prepared to go into executive session. Councilor DeMott?
Yes.
Councilor Seymour?
Yes.
Councilor Scully?
Yes.
Mayor Pro Tem Sites?
Yes.
Councilor Smith?
Yes.
Councilor Bowles?
Yes.
And the mayor. Our public meeting is adjourned. It is now 8:11. Council, I'll ask you to, as soon as you can, navigate to the new section. Everyone have a good evening.